Are you looking for a space where you will learn to improve your mental strength, emotional health, and heal your insecurities from the inside out? Take the first step to living a more meaningful life with the Better Me with Body by Bree podcast. I'm your host, Bree. I'm a certified personal trainer, entrepreneur, and mother of 3. I've helped empower thousands of women to take action through fitness, nutrition, meditation, personal development, and aligning thoughts with action. This podcast is for those who are ready to feel inspired and motivated to live a more purposeful life. Let's grow together. Hi, everyone. Welcome to the Better Me podcast. Today, we have a special guest with us, and I am so excited because he is pretty special. We have our very own plastic surgeon, Dr.J, on the podcast. Welcome, Dr.J.
Hi, Bree. Thank you so much for having me. Really appreciate it.
Thank you for joining us. I absolutely love Dr. J and everything that he stands for. Not only was he awarded LA's best plastic surgeon, but he treats his patients with compassion and he takes the time to walk you through exactly what's happening and why. So I really love him for that. He educates you. He's also a double board certified surgeon, and his practice is in Beverly Hills, but he has people flying in from all over the world just to see him. He's rated in the top 10 plastic surgeons by the National Academy of Plastic Surgeons. He's been featured in Cosmopolitan magazine. He's a celebrity plastic surgeon, and you would never know because he is the most down-to-earth doctor you'll ever meet because he makes everyone feel important. We're so excited to have you. Are you ready?
I'm so ready. I really appreciate the introduction, and I'm so delighted to be on your podcast. And I have so much respect for you because you're not just a personal trainer, which I know many. I love how you take a multi-dimensional approach to the body as a personal trainer. You have a very open mind, and you're very open to all aspects of the body, not just plastic surgery, but I see how you take care of your clients as far as nutrition, diet, as far as their activities, daily living. And that's why I have so much respect for you as well. And I accepted to be on your podcast. And I really appreciate this meeting.
Oh, thank you. You're the nicest.
Yeah, absolutely.
I appreciate that.
Yeah,
See, that just goes to show how sweet he is. He really is the best.
absolutely. It takes one to know one.
All right. Well, when I asked my followers what questions they wanted to ask a plastic surgeon, a lot of them were centered around surgery after having kids. And we all know how hard that process can be for moms. And I never want women to feel like they have to get plastic surgery. But I also am not against a woman just wanting to feel her best and take care of things that have been stretched out and torn apart. So obviously I'm a personal trainer and I believe that you can do a lot to improve your body with hard work and the right nutrition, but there are also some things that you cannot fix on your own. For example, loose skin, diastasis recti, umbilical hernias, or even like sagging breasts. So let's chat about a couple of these. And like the first question that I had from multiple clients was, how do you know when you need to get surgery to repair your ab separation or when you can fix it on your own through exercise?
Well, that's a really good question, especially from me, because as you mentioned during your introduction, I'm a double board surgeon. So I can answer that not only as a board certified plastic surgeon, but also as a board certified general surgeon who did hernia surgeries. And I've done hundreds of hernia surgeries as a board certified general surgeon before becoming a board certified plastic surgeon and doing thousands of abdominoplasties, pendiculectomies, abdominal wall reconstructions for trauma, burns, and many other reconstructive reasons. So I'm very familiar with the abdominal wall, and now I've dedicated my entire practice to aesthetics, and one of my most common surgeries is mommy makeovers, which basically is bringing back mom's bodies, and that's why it's called mommy makeover. So basically, we reverse all the changes moms go through during pregnancy. To clarify, there's rectus diastasis and there's hernias. Rectus diastasis is a normal phenomenon that some abdominal walls will go through during pregnancy. During pregnancy, the hormones, estrogen, progesterone, will go up to loosen up the ligaments and some of the structures to prepare the abdomen to carry a child and eventually deliver the baby through the vagina. So obviously the vagina itself will be prepared to stretch out, and everything else will be prepared to stretch out. Now, after the delivery, the linea alba, or the structure between the two rectus abdominis muscles, may not contract back. So that separation between the two muscles will be called rectus diastasis, or in other words, very simply put, separation of the muscles. So that's the rectus diastasis. The difference with the hernia is that it does not have a sac. It does not have a distinct sac. So that is a difference. Some of my patients ask, like, is there a hernia? Do you feel a hernia? Do I need a hernia repair? And it's a very good question. And it may be accompanied with a hernia, which most commonly would be a umbilical hernia or a belly button hernia, which is above or below the belly button, which is going to be a very distinct defect. And there's going to be a sac coming out, and you could actually feel it with your finger, and there's going to be a sac coming out. That'll be a hernia, which could happen during pregnancy as well. So now what are we going to do with rectus diastasis or the hernia? Hernia is a separate procedure. We have to do a hernia repair. We have to reduce the hernia, put the contents back into the belly, and repair it. It'll depend on the types of the hernia. Sometimes we have to repair it with a mesh. If the defect is too large and we can't bring the two edges together with sutures, we have to place a mesh to reinforce it. It's a complete different surgery.
And you can't do that. You cannot repair a hernia on your own, correct?
No. There's no way
never repair.
Repair a hernia on your own. No.
Right.
That is a complete surgical procedure, and it's medically necessary, actually. And it's
right.
And it's covered by insurance too. It's something that could become very dangerous because the abdominal content, like the bowels, for instance, it could actually come into the hernia sac and it could get stuck. So, they say it could get incarcerated, so to speak. Right. And it could block off the blood supply, and, it could get very dangerous. It could die, for lack of a better way of saying it. It could get strangulated, and it could lose blood supply, and it could get very dangerous. So it's something that needs to be addressed, and it needs to be repaired. And obviously, it's something medically necessary, so it'll be covered by insurance. So you simply look at your insurance, and you see, the surgeon on your plan, on your network, and you go to that surgeon, and you have it repaired. It's completely something separate from rectus diastasis.
Right.
Rectus diastasis is not something medically necessary. It's more of an aesthetic issue. Now, when it comes to aesthetic issue, it's it's something that it's not like medically necessary, but it becomes like, do we really need to address it, or do we not need to address it?
Well, and
Um,
sometimes when you're like when you have such a wide gap, it can really cause like back issues, right? Because you have no
exactly.
core.
Thank you. Exactly. See, that's why I know you address things in a very open mind, in a multi-dimensional perspective. Exactly. So, just like you said, when you have loose abdominal wall, the loose abdominal wall itself may not be the issue, but it can contribute to other problems. And we do have referrals from neurologists that the loosened abdominal wall is causing like back problems. So we do repair it secondarily. And what we need to do is we literally go back and at the time of the tummy tuck, we repair the abdominal muscles and we bring the two abdominal muscles back together with sutures. And we literally bring the muscles together from the xiphoid from the little bone at the chest wall all the way down to the pubic area.
So when you're checking, when you're doing an exam, is there like, oh, if you have 2 fingers or greater, you need surgery to repair it, or is there any type of rule with that rule of thumb if people want to check on their own and see how big their gap is?
No, there's no. I mean, it's very tough to really know that. For you to tell, really, it's more symptomatic, and it's a matter of like a choice.
Yeah. And
It's not.
a lot of women, it'll be like a pot belly, right? Like it'll make them kind of look like they have a pot belly because it's so stretched out.
Right, right, right. And yeah, these are some. These are some of the things that best is to find an honest plastic surgeon, you know, and just have it like a nice thorough consultation and just review it with them, and like you said, you or like a personal trainer like yourself.
Yeah.
You look at you look at your client, you look at him, and you press on the tummy, and you can feel. I know you can. I know you
Yeah.
can easily press on their tummy, look at the edges, and knowing you can easily feel the edges of the rectus diastasis and say, "Hey, listen, you know what? This is something that we need to address this, and we need to bring the edges together."
Right. So, can you repair diastasis recti without a tummy tuck?
No, no. There actually when it comes to, when we say repair is only with the tummy tuck. You only bring in the when you say repair, that itself says it has to be with the tummy tuck, and we have to correct it or repair it, and we have to fix it with a tummy tuck, and we have to like suture the two edges back together, and strengthen the abdominal wall with through a tummy tuck, basically.
Got it.
Yeah.
So,
In fact, oh, sorry. Go ahead.
no, I'm sorry, you go.
In fact, like crunches will make the rectus diastasis worse.
Right.
Crunches, like any exercises that targets your rectus diastasis, or like these yoga exercises, like a down dog, up dog, or any of these exercises that targets your rectus abdominis muscles, will make it worse. If
Right.
any exercises, now you would know this better than me, but any exercises would be like would be before doing it would be good, or after. If anything, would be the external obliques, or anything that does not focus on the rectus diastasis, but anything that would be focused on it will actually may turn the rectus diastasis into a hernia.
Yes, that's why I'm always stressing to have the correct education after you have a baby. You can't just go and start doing like a million crunches to try to bring the abs back together because it could pull them farther apart. So I'm
Exactly.
glad that you said that. So
Exactly.
how soon after you have kids can you have a tummy tuck or a mommy makeover, is there a certain amount of time that you suggest waiting before you want to do that surgery?
Very good question. So the best answer is you have to be at your stable weight. I can't give a timeline because um, it differs from one person to another, because it may take one person 3 months to get back to their stable weight. It may take one 6 months to get back to their stable weight. So
Right.
generally speaking, from what I've seen, I've had patients, they've been very anxious to have their bodies back. So we've had mommy makeovers 3 months after delivery, after their babies. And I've had patients back to their stable weight 6 months. Generally speaking, safest would be 1 year. A year
Right.
after is where is like, you know, it's like a good timeline. But we've
Yeah.
had ambitious, moms who really they know this is going to be their last child, and they already have their mindset to have their bodies back. So
Right.
2 months right after we've had mommy makeovers, and they already were had their mindset not to do any breastfeeding, and they've come and they've had their breast lifts, OGs, and their tummy tucks, everything all together.
Awesome. Thank you. So
Yeah.
I know, let's talk about loose skin. I
Yeah.
know that some women are really uncomfortable. I haven't ever had a C-section myself, but you know the flap of skin that hangs over a C-section scar. What
Yes.
would you do to help them? Would that be a tummy tuck, or is there a way to help with that loose skin that hangs over?
Sure. So when it comes to skin, it varies so much from one person to another. It's all over. So it all comes down to genetics, and at the same time, how you take care of your skin with nutrition, or simply put, just avoiding sun and using moisturizers. Very easy. So it all comes down to skin elasticity. No matter what the etiology is and how you come to it, it's skin elasticity. That's why you see some girls just after one baby, they may have a lot of stretch marks, and they may have a lot of loose skin, or they may have like one weight fluctuation, like one weight loss of 30 pounds, and then they may have a lot of stretch marks and like loose skin. And then you may see moms with 5 babies, and they're fit as like nothing happened. They have like
Right.
skin. So it all comes down to skin elasticity, and what determines skin elasticity is genetics. That's the most important one. And then we have other factors such as like nutrition and how you take care of yourself, avoiding sunlight, and all the other minor factors, but it's mostly genetics. Having said all of that, let's get back to the question: the C-section scar and the skin flap over it. The C-section scar heals different, and that has two factors. One, obviously, is the patient and everything else we just said, but the other one is how it's sutured. Sometimes, if it is sutures down to the fascia, which is the underlying layer, that will cause the irregularity that you see, and that may cause it to scar in a way that the skin over it will kind of like form a little bit of a little flap, for lack of a better way of
Right.
saying it.
Right.
So it's a few things. So it may heal in a way that the overlying skin may like scar down and attach to the underlying fascia over time, or it may be sutured to the underlying fascia, and the skin will like hang over the scar, or it may just be after pregnancy, the skin will not retract back. And no matter how the scar heals, that skin will hang over the scar. So there are many reasons for it. But the solution's easy. That does not need like muscle repair or anything like that. Those we just remove that old scar and we remove that little bit of a skin, and the recovery is extremely easy. It's like 2-3 days of like just like babying the scar, so to speak, and that's all it takes. I mean, like you can
Oh,
have
that's
that.
good.
Yeah, that surgery is very easy. You can, especially if you have an office job, you can have that done on a Thursday or Friday and go back to work on Monday.
That's
That's a
great.
very easy scar revision. We remove the scar, we remove that excess skin because there's no muscle repair and there's no like excess, skin removal. It's just, there's no muscle pull, there's no tension on the incision. We're just removing that excess hanging skin, which is already there.
Right.
You know what I
Right.
mean?
Yes,
Yeah.
yes. So helpful. Thank you.
And at the same time, the patient can have a pubic lift because the pubic area could get stretched out during pregnancy or as a result of the same scar, which may not be as noticeable, but the same principle that you see the abdominal skin hangs over, when they lay down, the pubic skin actually will look kind of normal.
Right.
So same principle, we not only pull down the abdominal skin, same principle, we pull up the pubic skin and we tighten up the pubic area. All can be done all at the same time. And
Oh,
patient
that's super helpful.
2-3 days. Yeah, very easy surgery.
Awesome. That's good for my clients to hear because I know a lot of women really struggle with that. So that's really helpful to know that there's something they can do about it. They don't have to live with that. So let's talk about implants. I know a lot of women have implants, and one of the main questions that I get is, can you work your chest after you get implants, or do you want to stay away from lifting your chest specifically?
Very good question. So the answer is yes. The answer is yes. But there's two ways of having your implants, over the muscle and under the muscle. Overall, under the muscle is better than having it than over the muscle.
Right.
Now, there's no such thing anymore, at least when it comes to a reputable plastic surgeon who does breast augmentation. There's no such thing as completely under the muscle anymore. That's a very old-fashioned way of doing it, which is called submuscular or under the muscle. When it comes to placing the implants under the muscle, plastic surgeons, the board-certified plastic surgeons, the teaching is to do it dual plane fashion, which means 90% of the implant is under the muscle and then 10% of it kind of sneaks out at the bottom and forms the nice round shape at the bottom of the breast, which forms a round shape. So a good plastic surgeon will shape the bottom of the breast to make it nice and round, and then the implant will maintain the roundness of the bottom of the breast. No matter how, if it's a tubular breast, because not all breasts are shaped round at the bottom, but a good plastic surgeon will shape the bottom of the breast round and then will have the implant maintain the roundness. So the implants are planned in a dual plane fashion, which is the same thing as saying the implant's under the muscle as opposed to being over the muscle. Right?
Right.
Okay. Now, there's no question that the implant being under the muscle is better than being over the muscle. The implant being over the muscle will show more. So let's go pros and cons. Let's do the easy one.
I love that. Okay.
Yeah. All right. Let's go with the easy one, which is which is more palpable. So the implant being over the muscle. All right. So when the implant's over the muscle, it's more palpable, right? You see it easier, especially if the patient doesn't have much breast tissue. The implant is in direct contact with your breast tissue, right? The implant will sag more because obviously the only thing holding on the implant is the skin, right?
Right.
And the chances of the most common complication after breast augmentation, which is capsular contracture, is much higher. right? Because
Mm-hmm.
the inflammatory process, which can be caused around the implant, initiating the capsular contracture will have a higher chance when the implant is over the muscle. So for those reasons, the implant being over the muscle is less preferred.
Got it.
Got it? Good. So now let's talk about the implant being under the muscle, right? Which is dual plane. Okay, so when it goes under the muscle, we have two types: completely under the muscle and dual plane. But like we just talked about, there's rarely surgeons do under the muscle. Rarely. I mean, I don't know of any surgeon that does it completely under the muscle anymore. So it's dual plane, at least in the hands of reputable surgeons, or most, not all the surgeons that I know of, or they should be doing it.
Okay.
Good. So when it comes under the muscle, there's one, so all the things are good. So there's much less chance of capsular contracture when it's under the muscle, right? The implant, well, the shape is much better. You're going to have more chance of having the teardrop shape. The implant's going to be much less palpable. It's going to look much more natural. And it's going to be much more durable. And the only one problem you're going to have when the implant's under the muscle is what's called animation, because the implant's under the muscle. So if you contract your pec muscles, the implant will move with the pec muscle. That's called animation. That's basically one of the only issues that we have with the implants being under the muscle. So when we have patients who do a lot of sometimes when patients are bodybuilders, for example, or patients are really want to build up their pec muscles. So this is something that we really discuss with them, and we really have to make sure that they really understand the difference between under, over muscle, the pros and cons, and the difference between the animation and non-animation, and so they really know the differences and to make a well-informed decision. But aside from the animation, from all other aspects, still the dual plane is preferred over being completely under muscle or over muscle.
So even if you get your implants under the muscle, do you need to be careful of lifting your chest so it doesn't pull the implants farther apart, or does it not matter at all?
Yes, no, it does. So it does. So when the implant's under the muscle, the more you work your muscles,
it'll pull them farther apart, right?
It will pull apart, yes.
Okay.
With contraction, there's a chance that it will pull apart and go toward pull away from your cleavage, so to speak.
Got it. Okay, that's so helpful.
Yeah.
So, okay, so this is the biggest question. What are your thoughts about implant illness? I know that's a loaded question right now.
Yeah, no, it's a good one. No, it's a good. Do we still have enough time, because that's a whole nother subject? But
okay, how about we skip implant illness, and I'll just ask you one more question about implants, and then that'll be the end.
Well, however you like. However you like.
No, it's okay, because I like to try to keep them under 30 minutes. And
okay.
So I think it'll be good, just to answer, we'll sum up the implant section, and then I'll just say, thank you so much for joining us. If you guys have more questions for Dr. J, let me know, and maybe he can come back or something. And then if we want to tackle that, we can another day.
Whatever you like.
Okay. All right. Okay, so Dr. J, do you still have to replace your implants after 10 years?
Very good question. Very good question. So, very good question. So there's no such thing that you have to change your implants after 10 years. So it's not like you put on your calendar like 10 years from now, I'm going to go back to Dr. J and he has to remove and replace my implants just because.
Right.
10 years. There's no such thing. However, you can't consider breast implant a lifetime device. So it's not like now that I have these implants and Dr. J told me that I don't have to change them every 10 years, I'm just going to have these forever and I don't have to do any other surgery. So you can't think of it that way either. So let me expand on that. So the implants itself, you could have these forever. There's no such thing that at 10 years you have to change them just because. But you have to have an open mind that you may want to change them, or you may have capsular contracture, or you may have babies, you may need a lift, you may want to go larger, you want to go smaller, you may, for any reason, you may need another surgery. But there's no expiration date on these implants, and there's no such thing that you have to change these implants every 10 years. In fact, they do have at least the ones I use, they have a lifetime warranty. If any time during your lifetime they rupture, they'll give you a free pair. And even if they rupture, the implants are all cohesive. What does that mean? That means that even if they rupture, they don't spread anywhere. They stay in one place. And after the third month, usually the body forms a very thin capsule around the implant, which is very different from a capsular contracture. It's a very normal capsule around the implant, which basically it's a little layer between the implant and the body. So even like, let's say theoretically, the implant ruptures, although the contents will not go anywhere. That's why Sientra gave them the name, gave the implants the name gummy bear, which is completely a marketing term, which basically implies that they're cohesive. They don't spread anywhere, just like gummy bears, which you bite through it, it doesn't spread anywhere. Which is still going to be inside that capsule. So there's no worry about the implants. You can have them forever. You don't have to change them every 10 years. But when you have these implants, you have to have an open mind that you may need more surgeries. But you may not need them and you may not have them.
Okay, awesome. That is
Does that make
really
sense?
helpful.
Yeah.
Super helpful. Dr. J, thank you so much for
You're
helping us.
so welcome, Bree. Absolutely.
You're
My
so
pleasure.
knowledgeable and you're just so great at answering in depth so that we understand and educate. So thank you. I really appreciate your time.
Anytime, Bree. Anytime. It was such a pleasure, and I love your questions. And it's always a pleasure talking to you. And I know when you and I start talking, even when we meet in person, it can go on and on.
Yep, I know.
I can't believe it's already like it's more than 30 minutes. I can't believe time just flew by, and it was such a joy. Seriously.
Thank you. I really appreciate it, Dr. J.